Imagine being so sick that the only thing that could save your life was a trip to see the doctor. In the Middle Ages, this would have been an almost death sentence. That's because medieval doctors were more likely to kill you than cure you. They had no clue how disease spread, and their treatments were often worse than the diseases themselves. During the Middle Ages, there were many different theories about how illnesses were transmitted. Some people thought that bad air or evil spirits caused sickness, while others believed that diseases were a punishment from God. Because of these beliefs, treatments for illnesses were often ineffective or even harmful. For example, during the Black Death outbreak in Europe in the 14th century, some people believed that the disease was caused by an excess of bad air, so they tried to treat it by smelling flowers or herbs that were supposed to purify the air. Of course, this did nothing to help the sick, and many people died as a result. Another common treatment for illnesses during the Middle Ages was bloodletting, which is the practice of removing blood from the body through methods such as leeching. The theory behind bloodletting was that illnesses were caused by an imbalance of the four humors, which are qualities that were believed to be present in all living things, namely phlegm, yellow and black bile, and blood. By removing the offending humor, the body could be brought back into balance, and the illness would be cured. However, bloodletting was not only ineffective against most illnesses, but it could also be dangerous. If too much blood was removed, the patient could go into shock and die. But despite this, the practice continued well into the 19th century. The bubonic plague, also known as the Black Death, was a horrible disease that killed millions of people in Europe in the 14th century. Symptoms included painful swellings in the groin and armpits, fever, chills, and vomiting. Bloodletting was one of the common treatments for the plague, but it was not very effective. In fact, it may have even made things worse by weakening the immune system. Despite this, bloodletting continued to be used long after the plague had run its course. A lot of doctors in the Middle Ages had absolutely no idea what they were doing. It was not uncommon for them to make mistakes that led to the death of their patients. For example, in the late 1800s, a doctor named John Brinkley performed a surgery on a woman that he had never done before. The surgery was botched, and the woman died. When her family sued Dr. Brinkley, he claimed that she had died because she had drunk a bottle of poison that had been given to her by her husband. Even though there was no evidence to support this claim, the court ruled in Dr. Brinkley's favor. This highlights the lack of medical knowledge and regulation during the Middle Ages. Doctors were not required to have any formal training, and there was no system in place to ensure that they were competent. As a result, many people died at the hands of so-called doctors, who were really just quacks. Physicians in the Middle Ages didn't wash their hands before operations, which led to infections and sometimes death. Ignaz Semmelweis, a Hungarian physician, noticed that the rate of infection and death among women who gave birth at a hospital in Vienna was much higher than those who gave birth at home. He concluded that this was because doctors were not washing their hands before delivering babies. Doctors typically only washed their hands if they were visibly dirty. Semmelweis began to insist that doctors wash their hands with chlorinated lime solution before delivering babies. After implementing this policy, the rate of infection and death dramatically decreased. However, the medical community was resistant to the idea of hand washing, and it was not until much later that the importance of hygiene in preventing the spread of infection was widely accepted. During the Middle Ages, surgeons would often amputate limbs without using anesthesia, meaning that the patient would be wide awake and feeling all the pain. This was obviously extremely cruel, and it often led to the death of the patient. In some cases, surgeons would use opium or alcohol to put the patient to sleep, but these substances were not very effective, and the patient would still be able to feel pain. It wasn't until the 1800s that anesthesia became more widely available, and it was another 50 years before it was common practice to use anesthesia during surgery. In the Middle Ages, it was common for people to die at home from diseases such as the plague. However, some people who were wealthy enough to afford treatment would seek out the help of a barber surgeon. These surgeons would travel from town to town, performing surgeries on the sick. However, these surgeons were not always competent and often did more harm than good. In addition, they would sometimes leave their patients with horrific scars. Because of this, people began to associate barbers with unpleasant things like pain and disease. To avoid this negative stigma, barbers began to specialize in other services, such as shaving and hair cutting. Believe it or not, there were many doctors during the Middle Ages who actually did a pretty good job. They weren't able to cure every disease, and sometimes their methods were a little bit iffy, but overall, they weren't trying to kill their patients. One of the most famous medieval doctors was Avicenna, an Arab physician who lived in the 12th century. Avicenna was a polymath, meaning that he was knowledgeable in many areas of study, including medicine, philosophy, and astronomy. He is best known for his book, The Canon of Medicine, which was a comprehensive work on medicine that was used for centuries. Ibn Zohar's work helped to advance the field of medicine, and he is considered to be one of the greatest physicians of all time. While many medieval doctors were incompetent, there were a few who were highly skilled. One of these individuals was Guy de Chauliac, a French military surgeon who lived in the 14th century. During his career, he treated soldiers wounded in battle and gained a reputation for his skill. After retiring from military service, he became a professor of surgery at the University of Paris. Guy de Chauliac was one of the first surgeons to use antiseptics and to develop new surgical techniques. He also wrote a book on surgery that was used for centuries. Despite the fact that many medieval doctors were ignorant, there were a few who made significant contributions to the field of medicine. Even though medieval doctors had some successes, they were definitely outweighed by the ignorance and incompetence of many physicians. This resulted in the deaths of countless people who sought out medical treatment. While we should remember the accomplishments of the great doctors of the Middle Ages, we should also remember the harm that was done by those who were not so skilled. After all, it was their ignorance and arrogance that led to so much death and suffering. The Dark Ages wasn't quite as dark as some of the other periods in history, but it wasn't exactly a walk in the park either. It was a time of great change and upheaval, and it also saw the rise of some truly terrible diseases. If you were unlucky enough to get sick during the Dark Ages, you might find yourself in the care of a doctor who was more interested in killing you than curing you. Fortunately, we've come a long way since then, and today's doctors are much more concerned with saving lives than ending them. But it's important to remember the lessons of the past so that we never repeat them. Now check out why medieval knights couldn't actually fight or click this other video instead.